Oh, Michael. Michael, sorry. Can I call you Michael?
Oh, Micha.
I'll call you the Irish version, Michal.
Okay, take it. Don't confuse him now. Okay, great. So I ask people to sit down.
Oh, good.
Oh, no, you shout now and I go. You
Okay.
say people should sit.
If everyone can take their seats, that would be great. Thank you. Okay, you're all very welcome this morning. I hope there's not too many sore heads. I heard there was some partying until 2 or 3 a.m. So I hope everybody is awake and even slightly fresh. My name is Lynn. I'm an Irish parliamentarian and I will be facilitating this amazing panel here this morning. I'm going to try and speak as slow as possible. My Dublin dialect does not get picked up very well in translation. And I would probably then suggest as well to the speakers if we can keep the rhythm of the conversation slow enough so everybody can pick up what's happening this morning. So I'm joined today by Femke Helsame, the Mayor of the City of Amsterdam, Philippe Close, Mayor of the City of Brussels, Pavel Bem, who is the previous Mayor of the City of Prague and Global Commission on Drugs, Alan Casey, a councillor of the City of Glasgow. I have Carly Heat, the Nighttime Economy Advisor and City Council of Bristol. And then I've Robert Czak, Drug Coordinator of the City of Budapest. And I've Michael Hahn, Addiction and Drug Coordination Department in Vienna. So as you can see, we have a very big panel and I've heard some of you can talk. So I hope we can avoid having to ring the bell at all and interrupt any speeches as we've a lot to get through in a short space of time. This particular session is looking at the transformative roles that cities in drugs policy can play in terms of innovation. I think when we think of words like transformation and we think of power, and often we imagine that power is potentially something negative sometimes or has negative connotations from times gone past. But cities and mayors and councillors and can act as a conduit in terms of how to disperse that power for good in the cities that are represented. I remember when I was first elected and my campaign manager said to me, if you are in the role and you're not pissing people off, you're not using your power correctly. So that's usually the measure in which I try and keep pushing the boundaries. And we have plenty of people on the stage today who have been pushing those same boundaries, working to ensure that the cities in which they live and work and represent, that the people who live and work there can see themselves in the city. And regulation is a big part of being able to see yourself in a city. So I won't add too more to my contribution, as I think we have a huge amount to get through here. In the first part of the contributions, I'm going to go to Femke first and then Carly. And the question that we have today for you is, what is the role of cities in shaping innovative and progressive drug policies? And how does your city exemplify this? Femke. Yeah.
Well, good morning. Good morning, everybody, and thank you very much. I think cities are in the forefront of changing drug policy, and I think they have a big responsibility. And they have to be in the forefront because we see it daily on our streets. We see people being addicted, the health hazards, and we see the crime connected to international drug trade. If you look at Amsterdam at the moment, I think we became very important, and important should be, I try to say it ironically, because we became very important in the international drug trade, being a city of trades historically. Especially in the coke trade, Amsterdam plays a huge international role, and it gives us a lot of problems. It gives us problems in our local economy because more and more shops are being undermined by criminality, by organized crimes. But we also see it in the future and the vulnerability of youngsters, and especially youngsters from migrant backgrounds who already have a difficult life and a difficult future ahead of them. So what we should do as cities is address this on a national and an international level, as we did in Amsterdam last year. We organized an international conference with the title Dealing with Drugs. And it tried to find answers to the question, not are we in favor or against regulation, but answers to the question, how are we going to regulate? And not only cannabis, but all sorts of drugs. Because to me, as a local governor, it is really, I really cannot understand why we cannot have a rational and logical discussion about an international economic problem, because that's what it is. And if it's also a health problem, which it is, although some forms of drugs, I really cannot understand why we give a consumer goods that has health risks in the hands of international and immoral criminals. Because if there are health risks, that's another reason to regulate. So we try to have a national and international discussion on regulations, and we also try to give the good example, for instance, in creating user rooms for people who are hard drug addicts. We have our famous coffee shops. I think they are really famous, made Amsterdam famous all over the world, which give us problems, but they are also a form of regulating, and using cannabis has become very safe in Amsterdam. Trading cannabis isn't safe. And these are some examples, and I think I've said enough for now.
Yeah, thank you. That's
all right.
Thanks, Famke. Carly.
Hello. Oh, is this thing on? Yes, brilliant. So I think there's something, first of all, about cities itself. Like cities, at the heart of cities is community. 56% of the world's population live in cities, and by 2050, that will be 7 in 10 of us. And we're really deeply connected to our communities. We can move faster. We know the people involved to be able to make change happen, and we're able to get round a table quite quickly and be nimble when it comes to change-making policies. But we're also restricted by national government laws and regulations. So when it comes to things like harm reduction in the UK, we've got a lot of prohibition when it comes to different substances, apart from alcohol and tobacco, of course. So whilst we can move quite quickly, we're also held back. And for things like councils and the police and the regulatory services, we also have to abide by the national state laws. So we have to kind of find ways to work within those state regulations. And when we're asking for permission for the Home Office to give us things like drug checking services or drug consumption rooms, that process can often be very, very slow. But within cities, we've got lots of people and partnerships that are able to get together, and we to be able to work together towards that common goal, despite of the fact of their different perspectives that they come from, whether that's legal, regulatory, or whether that is from the harm reduction community itself. Now, my job is as the nighttime economy advisor. I'm not a politician like the others on the stage, but my job is to represent the city from 6 p.m. to 6 a.m. And that is also within licensed spaces and recreational spaces. So as Bristol City Council, we have a drug and alcohol policy that includes problematic substance use, it includes alcohol. There is some recreational substances within there, but recreational substances have often been ignored from the conversation around harm reduction. When I first started in 2021, we were still in lockdown, and on the first weekend of reopening, we had 20 hospitalizations and 1 death in that first weekend from people who were not socialized, not used to being socialized to vertical drinking and, going back out, and they all went a bit too hard, too fast. But what we were able to do is get round the table very quickly and be able to discuss how do we not do this next weekend, because it's not the fault of licensed spaces if people are becoming unwell. It's a public health issue. And we had, round the table, we had Bristol City Council, we had the fantastic Bristol Drugs Project, the police, both universities, and all of these institutions had harm reduction in their policies and something that they were looking towards. So I was questioning, well, why do we have zero tolerance when it comes to licensed spaces? If all of our institutions believe that a public health approach is the right thing to do, then why are we asking the places that sell alcohol to not acknowledge that other substances exist and plan for safety? So we agreed to come together on a unified approach when it came to harm reduction in night spaces, in licensed spaces, social spaces. And that's really about it being a pragmatic, a public health-focused approach to alcohol and other substances. And what it does is it enables us to unlock us to have an open conversation with our communities. Nightlife is often seen as quite problematic for local councils. It's often seen as a thing to be governed or to be solved or to be, to make sure that they're not out of order. But really, nightlife can be a source of solution, a source of a public health intervention. We've got communities in the room and we're able to talk to them in a way that's non-judgmental and brings people along for the journey. So in 2022, we became the first harm reduction city in the UK with this unified approach. And what it's enabled us to do is to train our staff in nightlife to be able to recognise drug-related emergencies. It's enabled us citywide messaging on look after your friends and ask for help if you need it, and signpost to where the good advice is. Since then, we have got the first drug checking in the UK with the loop, and that's enabled us to actually have a lot more knowledge about what's coming into the city in terms of being able to test services. What we got with that is for dependent users rather than recreational users, and we would have liked it to go a bit further, but again, that's the limitations of the Home Office license that was given to us. But it has enabled us to do back-of-house testing, so where people are getting their drugs seized at club doors, the police can take it down there and test it and see what's in the population so we know what normal looks like. What it's also enabled us to do is move really quickly when we've had substances of concern come into the city. And recently we had loads of nitazines come into the city, and through those deeply embedded partnerships, we identified that they were there really quickly. We were able to get naloxone training out to all sorts of different types of organisations, not just the ambulance staff and the police, but also venues and other people who might be able to have that first contact with people. And we were able to knock that on the head really, really super quickly. And that is only possible in a city that gets around the table and talks to each other and is able to kind of communicate. I mean, we would love to go further, but at the moment we're the UK's first and only harm reduction city, and we would love more people to kind of join that table. And I think I'm probably about 5 minutes.
Can I ask one quick question? In terms of the public health approach to alcohol, do you ever find then when trying to advocate for a more vibrant nightlife, specific club licenses, longer licenses? I know we find that obviously we promote public health approaches to alcohol, but then it's those exact public health approaches to alcohol that seem to then oppose the nightlife economy. I'm wondering, have you encountered that at all?
I mean, the British love to drink as well, so there's something in there. But I think, you know, when we're talking about harm reduction, it's about being non-judgmental. You know, the Licensing Act does allow you to license for alcohol, and there are conditions within there that look for public safety and things like that. And, you know, there are harm reduction methods within the license trade that are long embedded, like Challenge 25 and those kinds of things. I think we are well practiced at trying to make sure that there's freely water available, that people are getting home safely, and I don't think the barriers really are being given new licenses, and certainly we don't have the same challenges as Ireland does with later licenses. We've technically had 24-hour licensing since 2003. But we're finding that young people are drinking a lot less anyway. A lot of that is to do with cost of living and changing of habits. And the pressure that's putting on nightlife is more of an economic pressure, because, you know, when nightlife really is about culture, it's about community, it's about coming together, it's about joy. It's not just about alcohol. And when you think about nightlife as a space for people to come together, we try to find ways in which that we can advocate for that in a more positive sense than it just being about the type of consumption that happens in that site.
Great, thank you very much. Next up we have Philippe Close and Alan Casey. And the question we're going to look at with you guys is in relation to how cities can balance public order concerns with the need for health-based drugs policies, and it's somewhat, I suppose, intersects as well with some of the work I'm sure that Carly is doing in terms of public order. So maybe Philippe or Alan, whoever wants to go first, you have the mic.
Yeah, it's a difficult problem because it's very strange with this subject. All my colleague, but not only my colleague, are always afraid to speak about this subject. Everybody knows that we have a big problem with criminality, with public order, with health problem, with our population, but immediately say, yeah, but it's too complicated to speak about. First of all, what I think is very important in my charge is take the advice of different specialists, psychologists, psychiatrists, police department, all the people, social workers, all the people we are in contact with this problem. Secondly, don't be afraid to innovate, to experiment what it happens in other countries. We are from different countries here, not only in Europe, and we know that this war on drugs, it's very, very difficult to win. Then, sometimes in the different conferences, we ask how we can win this fight, if we can win this fight. Who is the person who are drugs addict? But never we ask why the people is drugs addicts. And what I try to share with other people is why so many people using drugs. I think it's also the responsibility of all the politicians to understand what it happens in his own society. What we try also to do is the relationship between the different public services. I speak about police department and health services. It's very difficult because at the beginning they say, okay, we don't do the same jobs. But we have the experiments of more and more people with a mental disease on the public area who do public disorder, and the reaction of the public and the politicians is to call the police. Okay, try to manage this situation. And after that, 2 years ago, because we are people who are brought by the police to the jail during 12 hours, and some people died in the jail of the police after 12 hours, the police department say, oh, there are always polemics with us, but sorry, Mr. Mayor, we are not psychiatrists, we are not psychologists, we are policemen, policewomen. And then I put the chief of the police and the chief of the department of psychiatry of one of my hospitals together, and I say, okay, you have two specialists of this, not of the same way. What is your proposition for me? And then we create a special brigade we call EMUT. It's a special brigade who, when the police department constate there something happens in the public area, there are someone, not only with drugs addicts, but someone with a mental disease, they call them. And they say, okay, we have this person, do you know, first of all, do you know these persons? How can we react? Is a possibility to bring this person to the hospitals? Do you think there's something else different to do? What I want to prove and to say, and in fact, the first goal is to put the real specialists together. Not only to say, okay, we're going to fight against criminality. It's really important. But only to do this, there are no solution for me. And I always try to repeat that. To repeat is not only the problem of the drugs traffic. The first question is why so many people using drugs? In every level of the population. You know that now in Belgium, a large part of the cocaine comes from the port of Antwerp. And now what is also remarkable is the price of the cocaine is very low. This morning I take a coffee with a member of my staff and we pay €5. €5 is in the Starbucks. It's very expensive. But it's the price for a line of cocaine. And then I saw that in my city. People just before to go to work, who go to buy some cocaine before to work. It's not only people with a problem of poverty or something like that. It's in every level of the society. That the first thing, first of all, speak about the project, speak about the problem, and after that, put the different persons, the different services together to share the experiment and also to propose new solutions.
Philippe, would a new solution be to, when we think of specialists, also think of those involved in the drug trade as being specialists around the table?
I think if we can move for the people, for the drugs addict, not only with the criminality, but with the health solution, it's very important for me. If you have a problem, I'm a former smoker. I smoke more than 2 boxes by day of cigarette. At 40 years old, I decide to stop. I have someone who helped me to stop in the hospitals, who give me some advice, and who say, if you want to stop cocaine, heroin, or something like that, it's very, very difficult to find someone to call and to go there. If a family have a problem with this child, it's not easy because they are afraid to speak about, they are ashamed to speak about, and all of this. But first of all, is to change our state of mind and to understand that we need to pay attention that the drugs addiction is first of all a problem of health and social condition. If we don't do that, it's impossible to find a solution together.
Thank you. Alan?
Yeah, good morning. I think this is working now. I also have a strong Scottish accent, so I'll try and speak very, very slowly.
I have a special Belgian accent.
So I know it's sometimes very difficult to understand my accent, but I'll try my best. There's a very important question, actually, in terms of the balance between the life of the community, I would call it, in terms of people who are using drugs, but people who are also affected by it in our communities as well. I wear a pin badge to everywhere I go, and it's our city's motto, effectively, and it's "People make Glasgow." And that motto means all people. People who are using drugs, people who are impacted by drugs, families, our communities, and indeed just the wider population of the city. And I think that's hugely important, because for us to take forward a proper public health approach, we need to bring our communities with us, including everybody in the city, and also giving a voice fundamentally to people who are using drugs in our city as well. And that's something that we've been championing for quite a number of years. Glasgow, I feel, probably is a harm reduction city as well. Probably not officially got that title, but we've been taking a public health approach to drug addiction for many, many years, whether it be through our needle exchange programme. We've obviously got quite a significant naloxone programme now as well that operates in Scotland and indeed our city. And we've been championing harm reduction in terms of advocating for a safe consumption facility in Scotland as well, and in Glasgow. And thankfully we've managed to win that fight and that argument within the context of the UK, within the context of the Misuse of Drugs Act. But it's taken far, far too long. It's taken over 10 years of hard work from a lot of people. There's been a lot of advocates for that policy in Scotland. And also, one of the things I think we've done really well is we've managed to get a cross-party consensus, and I think that's hugely important because ultimately this is a political problem, it's a political issue. We heard earlier in the panel is sometimes it's not a popular thing to talk about. It's sometimes a very difficult subject to talk about, but we need leaders, we need strong local advocates, strong politicians who can really take this discussion forward and actually take the discussion into our communities and bring our communities with us. And that's something that we've been doing in terms of the delivery of a safe consumption room in Glasgow. So I think that is hugely important, but also bringing our police, our prosecutors, etc., into the discussion as well, because I don't think we will never win the war on drugs. It will never happen unless there's fundamental changes in the way in which we do that. And you will never, ever support somebody with an addiction by prosecuting them. It should never be a criminal justice issue. It should always be a public health issue. And that's the way in which we treat drug addiction in Glasgow and indeed in Scotland. And our police and our law enforcement are starting to come round to that same way as well. And they are now advocating for harm reduction. They're now advocating for, a public health approach to the problem rather than prosecuting, because it never works and it will never work. The war on drugs will never work, and that's why we need to look at radical changes to policy and to regulation. Glasgow, I think, became the first city to formally adopt a position of decriminalisation anywhere in the UK. So that is our formal position, but we don't have the powers to enact that, which is really frustrating. And I think that we need to drive policy change from a local position, whether it be local government or local councils, because we're at the front face of the services that we're providing to address this issue. National government don't see it day to day. And I think that's the huge problem. They're so far away from the problem where they don't really understand the issues. And when I say national government, I'm talking more about the UK government in this context, because I think the Scottish government have taken a real humane approach to drug policy, and they are now also advocating for decriminalisation within the context of Scotland and asking for those laws to be devolved to the Scottish Parliament, which is a huge, significant change. But we, as I say, see it in the coalface, so we're the ones that are driving that policy change, and I think we need to organise. We need to make sure that we are advocating for, first and foremost, decriminalisation. But I think we'll speak later on at another event potentially about regulation, and I think that's a hugely important thing. And I think politicians need to be brave. They need to grasp the argument, and actually, whether they take a view one way or the other, but it needs to be in the debate. We need to be talking about this, and we need to be making that radical change.
Thank you, Alan. And I think most of us realise and know that the war was never on drugs, it was always on people, you know, and I think we should take back a lot of that language in terms of the actual real impact of the war on and who actually is on the receiving end of that, because obviously it's never a substance, it's always a person and their family and their lives. We're going to move on now to Robert Chack and Michael Hahn for question 3, and that question is, what are the main challenges cities face in implementing innovative drug policies, and what practical advice would you give for local policymakers that are trying to drive innovation but are navigating these challenges? Thank you, Robert.
So good morning, everyone. Just a sec. I would reflect on what you said. So in terms of public safety, so I think it's a political question, so politicians should be a bit braver and back harm reduction, because, well, in my experience, those neighborhoods most affected with open drug scenes tend to be the most neglected or most poor neighborhood. So and the people live there tend to be most pragmatic, because they see the problem and they want effective solutions, effective methods to those problems. And I think politicians who would back harm reduction could gain, like, politically votes, because they would offer an effective and a cost-effective solution to that problem, and seems to be, and it's good to be someone who I don't know, like care with those people. So, okay, but on challenges, so I think well, there are 3 dimensions in these challenges. So in the legal dimension and the social and the financial dimension. So like, but it's been mentioned that cities should find their way in a legal environment that is set by the at the national level. So a city cannot aim for changing the laws, like big decriminalisation, but can lobby for those changes. And what we did in the drug strategy of Budapest, that we in every pillar, so like it's like every strategy, so I have like 4 pillars: the supply reduction, treatment, prevention, and harm reduction. So, and every pillar we made recommendations to the government and made recommendations to the districts, and we made like, and tasks for Budapest. So, and that is included in the action plan, but we have recommendations because it's important to acknowledge that drug-related harms is produced in this risk environment, and you have to acknowledge that there are some aspects that is not in city level and defined not in the level of cities. The financial dimension is like, well, in the case of Hungary, the healthcare system and the social welfare system is funded by the government, so we don't have the financial means to substantially increase the funding or increase the coverage of these services. But what we did is that we find what is the most problematic thing, and in case of Budapest is low threshold services and harm reduction services for the most marginalized people. So we put out a grant for NGOs who work in that area. So that's what we could do. And the third one is the social dimension. So that's where we have to, I don't know, like shape public discourse or try to shape it, but it's very hard because, as you might know, Hungary have a far-right populist government, and they are like stigmatizing not just people who use drugs, but people who work with people who use drugs, and harm reduction is heavily stigmatized. But what we can do is try to educate like the police and educate people working in the healthcare system, and try to bring those people together. So that's one of my solution. But yeah, other stuff.
Thank you. Michael?
Also, good morning from me. For us, as the city of Vienna, as a main challenge is to fill in the gap between the expertise and the decision-making of political persons and political decision-makers, how to fill in that gap. Because coordinating a system of public health and social care is often very difficult, very fragile. So addressing like topics like mental health and addiction is really complicating. And so we have to fill in the gap in the city of Vienna between the expertise and the political decision makers. We tried that as the coordination department of drug and addiction to fill in that gap, because we are coordinating all the fundings of the city of Vienna for all the people who have a drug addiction problem. So we try with this centralized coordination to lower the impact for the people. So it means we try to, for us, have less bureaucracy, have the better advance that everybody can have a drug addiction therapy, so we can meet the people at the best point of service with our centralized coordination. And also we have the drug coordinator, which is in Vienna, but in every part of Austria, who also has a political role, which is very, very important for us. It has two sides, like everything, but we can, as the department, advise the political decision makers what are new innovations, what we need in our drug policy of the city of Vienna, and also how we try to meet the problem is a really good coordination and communication between all the health service systems in Vienna. So we have regularized meetings with the child and welfare system, homeless system, and also try to target the stakeholders with programs so that we can lobby for our clients, for drug addiction and also mental health, and try to help the other employees of the other departments to deal with addiction problems for the clients. One of our newest program, this is really a practical device and shows how to work communication between departments, also between political decision makers, is that now employees of drug addiction services are going directly into homeless services, and there we can show the patients what we all have to offer, what they can do, how they can get therapy, so we meet the people where they are. And this only works if the political decision makers and the departments are working extremely close together. We also try it to work together on all levels, so the political decision makers, the leaders of the department, but also the basic employees of the department, so that we face the challenge of mental health and addiction as one problem, which is for us as the City of Vienna is really important because we work together with the police, the justice system, to also face harm reduction problems, which we have. We have a long tradition of drug checking, which we really tried and also gained the success the last 2 years, that we also have pharmacies now who are drug checking for us so that we see what is in Vienna. And yeah, the last thing, what I'm thinking, all of these programs and things we offer for the people and also the employees of the other departments are free of charge. Because we as a City of Vienna say it doesn't mean that we distribute the money from one department to another. So for the employees of Vienna, it's all free of charge. And the drug coordination department coordinates all of these fundings for the people who work in the other departments, but also for the clients, so that everybody has a really good perspective how to get a therapy or how to get help in the more of the harm reduction section.
Thank you. I'm wondering, in terms of obviously the gaps between expertise, both in terms of expertise by experience, but then also profession and policy makers. But I also wonder then the gap between how we think about drugs policy or how we expect policy makers to think about it. Because I often, you know, when we've heard a lot of language over the last few days, stuff like zero tolerance or, just that kind of a very abrasive language, or even how we talk about people who sell drugs. But there's very little analysis, actually, really, of the core drivers of not only addiction, but the reason why so many young males, especially from very, very under-resourced communities, see the drug trade as the only option in a capitalistic society where they need to have and they need to be seen to have and succeed and have purpose. And they find that purpose, but then are vilified later on because obviously that progresses. And I think there's something around then how we can have governments then, or policymakers, kind of say, well, it's zero tolerance on drug-related crime or zero tolerance, but there's never conversations on zero tolerance of poverty. So you never hear somebody come out and go, let's have a campaign where we're having zero tolerance on inequality and poverty. And I often wonder, and I wonder what maybe and you yourselves think, I wonder, is that because if governments or policymakers have to think about poverty, they have to think about their own power and privilege, But when they just kind of make statements about drug use or drug sale, they can point somewhere else over there. You know, it's the drug dealer, it's those people over there that have no education, or it's, you know, where if we actually start having an analysis on poverty and how that's created and compounds all the issues that we talk about, I'm wondering, is that one of the major challenges and gaps that we're failing to address as we walk around the edges on drugs policy?
I have to go a little bit deeper into that, because we are also addressing the problem of poverty as the drug addiction department. Yes? That's all we try in every meeting, to address this problem. We also combine it often with the problem of loneliness, because that is what we are facing in Vienna as a city now. We have a good structure of therapy and everything, but when the people are finished with therapy, they are met with loneliness, often poverty, what to do the next steps. So for us as the Department of Drug Addiction and also mental health, because that is also connected to us, and it's very important to have a great lobbying at mental health, to always combine it, that mental health and poverty and loneliness are three things you cannot divide. You have to look at them as one, and you have to find programs which are addressing them as one. So one thing for us that is very important in all of our addiction companies, companies is the wrong word, but you know what I mean. Services center, there are always social workers. There are always, you have a psychiatrist, a doctor, you have a social worker, and you have a psychologist. And all three of these professions have to work on the client. Unless that is not fulfilled, we as the department are not giving the service provider the money for the funding. So they have to have a doctor, a social worker, and a psychiatrist who work at the client. And for the social working system, it is necessary that it is addressed. How is the client dealing with poverty now and after the therapy? And how can we provide that he is also not facing loneliness as another problem after the therapy? That is sometimes unique for us, that we only have these three services. We have to work there. And also, if we give the funding free, also these three, a doctor, a psychiatrist, and social worker, has to look at all of the criteria so that they are fulfilled. And they are all the same level in the companies there.
Thank you. Does anyone else have a comment on that? Yeah?
Just, we need to pay attention that drugs is not only poverty. It really changed. It's true for the drugs addiction, for example, for heroin. We know that's all what it happens, but heroin is maybe 2 or 3% of the people using drugs. And also we need to pay attention, and I know it's a dangerous world, that all the drugs users are not drugs addicts. It's really changed. When I say that drugs in every level of the society, the people are very afraid when I say that. But it's maybe a real change to change the state of mind. We say, okay, it's maybe your son, it's maybe your brother, maybe your father who's using drugs. For example, it's not the same consumer. If you are in a rave party, for example, a pill of ecstasy costs less than a pint of beer. And I talk with young people, and I say, okay, man, why are you using drugs? They say, okay, but it's because I have no money to have 10 beers and to be high and to go on the floor, on the dance floor. And then, okay, I use a pill of ecstasy. I don't say it's good or not. I say it's a fact. Why do you use cocaine line the morning because you want to go to work? Because it helped me to do it. We know that it's not good for your health, but it's very, very important if we want to change the state of mind and to speak about the health problem of the drugs, to say it's not only this category that we call in the past people for using cracks, for example. It's true, it's the very low level, sorry for the expression, I don't like this expression, of the society. But for the rest, we need to pay attention that drugs is everywhere. And we have this problem in this society. We don't want to see what it happens. Why people are so stressed, why they want to use that, why they need to use drugs to go to work, to go to dance, to go to, I don't know, to have a social relationship. It's so important. If you have succeeded to convince all the people that drugs is everywhere and they have something very new to invent to manage this, I'm sure that we're on a good way. It's why it's so important to be careful to say it's only the poor people who are using drugs and they are this problem. If we do that, I'm sure that, and another thing very important for me, it's always the city who are ready to speak about that, because we need to manage that at the first level. The government say, yeah, but I have not a problem to manage it. Sorry, it is the Department of Justice, of Police, we need to do that, but for the rest, I have so many problems to manage. It's why the conference of different cities, to share the experiment, to share what we live in our different territory is so important for me.
Yeah, and I think we know and understand that everybody uses drugs, and that's an important conversation, but the distinction is the impact is felt differently. So those who experience poverty and drug-related crime and addiction, they're the ones that fill the prisons, and they're the ones that die at the hands of drug-related violence. So the actual impact is disproportionate when we move across the social classes. So that's more the point. Did you want to come in?
Well, as you probably know, I do agree with you. And let me say something else, because I think, if I look at my own city, 98 or 99% of the people who use drugs, it's not problematic. It's no problem at all. They use MDMA in the weekend when they go to a party, or they use cocaine now and then. They're recreational users, and it's not a health hazard. Yeah, probably for them now and then, but it's not a public health hazard. I think the abuse of alcohol in my city is a much bigger problem. And if I'm honest, if a youngster has the choice or asks me, he goes to a party in the weekend and he says, shall I use MDMA or shall I use shots of alcohol? I would say to him, use MDMA, do it wisely, do not too much, but it is not as dangerous. So what we do see is drug abuse becomes a public health hazard amongst marginalized groups. There is the problem. There are the people who are homeless, the people who are very poor, the people who use different kind of drugs again and again, and people who have PTSS. And there are many, more and more people from migrant group, asylum seekers, who use it as a form of self-medication. And there you have the problem, and it is because they are marginalized, not because of the use itself, but because we do not care enough for the people. The big public problem in my city is not the using of drugs, but it's the trade of drugs. There is really a problem, as you already said, because too many young people, especially vulnerable people, think it's their only way up in life. They trade in drugs, they all want to become a very rich criminal in Dubai, but most of them...
Is that an Irish reference?
Yeah, but most of them end in prison or dead. And that is really a problem, and the problem is the war on drugs and the criminalization of a consumer goods that is not that scary for 98% of the population.
Thank you. So I'm going to move on to the last two contributions, and we may have time for one or two questions from the floor. I'll check the time as we move up through this segment. Next up we have Pavel, and the question is, and it will be the same then to FMK as well, will be, how can cities collaborate, promote and scale innovative drug policies at a national and a global level?
Good morning.
I think that all of us here in this hall, we know what cities should do, and we also know what the decision makers and policy makers and politicians should do. There is such an enormous amount of scientific evidence behind us in these 40 years, or let's say even more than 50 years of the war on drugs, on unintended negative consequences and harms of punitive drug policy approaches. And we have such enormous amount of evidence what works. So I guess that we simply know what we should do. The question is, how can we facilitate all these processes from criminal justice responses towards the human rights-based and health-centered drug policies? I would like to touch two aspects. The one is, let's say, advocacy. I have one obligation and a privilege at the same time to share with you some of the latest developments of the Global Commission on Drug Policy in local drug policy reform. And maybe some of that was also covered by President Kwaśniewski in the opening remarks of the conference on Monday. The Global Commission on Drug Policy is a self-constituted body of former presidents and head of states. And the goal during its inception was to provide a decent diplomacy and evidence-based advocacy with the governments, with the prime ministers, with presidents, with law enforcement, Ministry of Justice, for example, etc. And I joined the commission because it was covering just the same ethos as I had as a psychiatrist and one of the first national drug coordinators in the Czech Republic in early 90s, designing the first or one of the first drug policies. The number one was decriminalization. So we have just to advocate for decriminalization because there is no sense of just putting people who use or possess any kind of substance into the prison. The second thing is harm reduction-based interventions, because as we know, if there is anybody who is addict, certainly as Mayor of Brussels said, need help and support and need treatment. But as we know, as Madam Mayor of Amsterdam said, most of people, they do not have the addiction. Why? Because those who have addiction, they have some other troubles. They have trauma, they have PTSD. They were not cared by a little child or newborns in the family which cares. So they have a disadvantage and they are stigmatized for all their life. So we need to certainly support them with treatment and social support and health support. The others, they maybe use various substances, but just they are put in a risk of being penalized, criminalized, and stigmatized by that, even though they made uncomparable public nuisance or troubles compared to those using during the nights alcohol or heavy drinking. So the thing is that the targeted interventions in various target groups, this is the key we already know. Destigmatization, refocusing the law enforcement money or law enforcement responses toward the highest level of organized crime. Because if we just invest the energy and money to street dealers, most of them are drug addicts. There is no way out of the war on drugs. And also the money spent on the law enforcement are enormous, and we need them in the health and social care. Regulation of drug markets, this was the 5th goal of Global Commission. So I think if we do that, certainly we have a limit to do that on the city level, but we can do that. And the Global Commission on Drug Policy has championed for last 5-6 years the local drug policy reform, brought 4 recommendations which are so clear, and I already noticed that: prioritize the health and safety. Drug policy must be coherent and inclusive, focus on violence reduction. This is what we need in cities. And I know that as a person who spent 12 years, not only 12 hours, 12 years in just being a governor of Prague, or the largest Prague district of Prague 6. Control of markets, just putting governments in control instead of law enforcement officials. So this is the way forward. I would love to share a very true and very personal story with you. 2 years ago, the Czech Republic has gone through a horrible, crazy criminal justice narrative. I reframed that to criminal injustice story. A young Polish family has been accused and finally criminalized for 8 years of imprisonment in the Czech Republic for organizing ayahuasca retreats. The accusation was based on DMT distribution. And it was unbelievable because there was no injury on health. There were so many reports of psychospiritual growth of those undergoing these retreats. However, the criminal justice or criminal injustice system put them in jail for 8 years. The professional community was absolutely threatened. So we started to provide the courts with the expert opinions, with the evidence-based. We were witnessing in front of the court. Well, there was no way forward. At the end, we convinced the Minister of Justice of the Czech Republic and the president, former President Zeman, and he gave a pardon to 2 young Polish guys, couple. So, what is the outcome of that reality for me? First, I think we need to have courage. And Madam Halsema, I have a great respect to you because you have a courage. And it's a simple statement, but that's true. If we know that we should do anything, should do something in just fighting the war on drugs, and we don't do anything, well, there is no way forward. But we also need something what I named myself as an inner soul congruence or inner soul ethos. That means that the ratio is congruent with our emotional state. The mother of the family system therapy, Virginia Sutter, said this is a fundamental condition for providing help to people. Congruency between emotions and ratio. On the ratio, we know that there is evidence that the war on drugs generate enormous harms, and there is an evidence that, for example, harm reduction services, they just provide the way how to help people effectively. So we need to have our own ethos, and all of us here, that's why we are here. We have it. We need a good strategy. And we are happy that we have, for example, Steve Rose among us, or in the Czech Republic, we have Viktor Mravčík, who has a strategic thinking, pushing things forward and showing us how to do it. And certainly among you, there are many others. We need a good advocacy, and this is what I started with. Global Commission, I think, is providing the advocacy good in a way, because if I just try to convince a prime minister of any country, having behind 27 former presidents and prime ministers, the command of this information, which is delivered, the content is delivered, but the command behind is extremely powerful. So we need a good advocacy, and at the end, we need a good networking. And thanks to correlation, because this is the way forward. And if we just keep ourselves in this inner soul ethos, I am not esoteric, crazy man, but I think that the soul is important. We need a courage, we need a good strategy, and we need an advocacy, and we need a good networking. This is, from my perspective, the way forward.
Thank you. So I'm going to come back to you now, Femke, to come in, and I know you two have to leave, so you aren't. If they leave the stage while we're still moving, it's not in protest. I know you have a meeting to get to, but do you want to respond as well?
Well, I already said some things twice, so I don't know if someone else. But if I may just thank you for what you said, and I would like to join you in what you're saying. I think we need to do two things. First, we need to bring back the health hazards of drug use to realistic proportions, and show people what works and what doesn't work. And harm reduction works. We know it works. Second, we need to have an economic discussion. I would like to have the economical arguments to the forefront, because all right-wing leaders around the world who are supporting the war on drugs, they are also missing out taxes, revenues that could be theirs if drugs were regulated. There are so many good economic reasons to find a way to very slowly create a legal economic system for drugs. And I know it's not, I'm not naive. It will take us tens of years to start, but I think we need to start it now. And let me just finish by something Philippe Kloos, my colleague from Brussels, said. He said rightly, you said rightly, well, cocaine is very cheap. Yes, it is. The street value of cocaine has been the same for tens of years. Although every year in the Antwerp harbor and the Rotterdam harbor, more kilos, more drugs are being imported. No, but also the police and they are taken. So it is just seen as an economic risk for huge internationally operating criminals. Because there is no change in the street prices. We have to explain this to the political leaders in the European and American countries who think that they are successful. They are not. And if we could create, especially for cocaine, an international trade system that is legal, that is safe, that is also creating an honest situation for farmers, especially in Middle America, then there is a win-win situation to create. Well, this is where I finish.
Thank you. Alan, you want to say a few words, and then we've maybe time for 2 questions, maybe.
Yeah, I'll be very brief. I just wanted to kind of point one thing out, because we're talking about trying to make, I suppose, progress in terms of harm reduction and advocate for cities and countries to develop new approaches. But one of the things I think we need to caution on is a regression of harm reduction policies, and that's something that we're seeing across the globe. So Canada, for instance, are looking at potentially shutting down safe consumption rooms and all of that kind of stuff, against all evidence, I may say. So I think we also need to be careful that we are working together to support those areas where they've already made huge advancements and make sure that there's no regression there. And that also has to look at proper investment in services, because I think when you make progress in terms of policy, or you open safe consumption rooms, it is so fragile, and if you lose investment in those policies, financially or otherwise, then you set a huge risk in terms of regressing backwards. For instance, we've got permission now to open a safe consumption room in Scotland, but that's at the whim of one person now, because it's the Lord Advocate has made a decision to give an exemption to prosecution policy. But if that role is ever to change, the new person that comes in could take a totally different approach there and say, no, I don't agree, that's a position. So we need to make build a huge evidence base, and as you say, a group of organisations, politicians, or cities or countries to advocate for that policy and make sure that we don't go backwards either.
Thank you. So, does anyone have a question? And if it's for someone in particular, if we can just be maybe concise and aim it towards a person, that might help to get a few in.
Good afternoon. My name is Konstantin Belikov, Deputy Mayor of Kryvyi Rog City in Ukraine. В мене питання до пана Філіпа. Ми почули, що у вашому місті працює мультидисциплінарні команди. Поліція, медичний працівник, соціальний працівник. Скажіть, будь ласка, це міська програма? І якщо це міська програма, чи є фінансове наповнення з міського бюджету?
I will help with translation. So, Mr. Belikov, the Deputy Mayor of Kryvyi Rog, is asking Mr. Philippe Claus, Mayor of Brussels, regarding this multidisciplinary team, which you mentioned, consisting of police, medicine, etc. Is it a part of some city HIV prevention program or any other program? And do you allocate money from municipal budget? Thanks.
In fact, as a capital of Belgium, we are very special because we manage 4 universities, hospitals, and I'm the chief of the biggest police of the country. Then it's maybe easier for me to organize that. But what is remarkable, that I convinced the federal state to pay for this special program that we call EMUT. It's a program where the police department works with the psychiatrist service of university hospitals. It's not only for drugs addicts, it's for all the problem of mental disease on the public area. And it's true, it's a pilot program, but now is a real reference between the different police departments to engage a new dialogue between police department and hospitals. And the first we ask for that is not only the politician of the population, is the police department, who said, sorry, you ask us to do a job, it is not our jobs to do that. Because there are so many critics, they say, but it's not normal, you don't do a good job, there are people who die in your jail, your suicide in your jail, and all of this. That my first advice is to say, if you put people together, and it's what I said, I asked to my chief of police and the chief of the department of psychiatrists to propose a solution for that, and after 1 month, not a long time, they have the project. It's also to be trust in the different people who manage that on the field.
Thank you. Any other questions?
Thank you. A question to everyone in the panel. Can you share any advice how to communicate to those concerned citizens who don't want to have a new harm reduction program in their local neighborhood? So not in my backyard. Do you have any tips how to communicate to them?
For example, for the consumption room, that now there are more than 60 cities who are using this program, and I think it's very important. Communicate, always. Transparency. At the beginning, it's very hard. You have the feeling as a politician that you're going to lose the next election. But after that, the people understand what you do. Use the different specialists who talk with you, doctors, social workers, psychologists, and all of this. But it's very, very important, always, and you organize meeting with the population, meeting with the Department of Justice, with the Department of Police, and together show on the different members of the parliament what is the reality of this room. This is not a hidden program. It's very, very important. Always communicating with journalists. You want to visit the Centrum? Come with me. You have the contact direct with the people who work in this Centrum. And my first sentence is what I say, that this is not a program to promote drugs. It is to find a cure, to find a solution for harm reduction. Because the first feeling of the people say, yeah, you are for drugs, but I'm not for or against. I say drugs exist, and I try to find a solution to manage. I'm not just dedicated to say, okay, comes in the Centrum to take drugs, it's very fun and not like that. And really important to communicate. And at the end, after 2 or 3 years of this opening of this consumption room, I think the only person who still a little bit against is the direct neighbor. And I understand him, because nobody wants that just in your direct neighborhood. But they are a special dialogue. He knows the people who was there. He has the phone number of the people responsible of the consumption room. That first of all, to speak about. I repeat the beginning of my speech. The very big problem with drugs policy is everybody is a little bit, not in this room, afraid to speak about.
We won't have time to go to the whole panel, but I'm going to bring Pavel in then, and we will be finishing up then.
One suggestion. Actually, we are living in post-factual era. You cannot convince people. This is my experience, actually. I'm leading the City of Prague Drug Commission. We are currently introducing 5 new harm reduction services, including the drug consumption room. It's horrible. You cannot simply convince somebody who is living in the house, in the neighboring environment, there should be a drug consumption room. This is my experience. So the only thing, as Madam Mayor of Brussels said, we need to provide evidence. That's true. But that does not work, at least from my experience talking with the public. So my suggestion is to use the same strategy as the people are using. They are using emotions. They are trying to convince you that there will be disaster in the neighborhood. They are trying to convince you that the kids of the families will be just injured by the used needles in the sand play corners. So the only thing is to bring those who are using substances, using drugs, being addicts, showing that they are human beings, that they have needs, they have the same intention not to do troubles, but to receive, to get support and health and dignity and human rights. And if they receive that, they are not going to be a part of the street drug problem. So use emotions, use emotional stories. Show the people who are just undergoing the treatment, having the challenging outcome of being treated, being healthy, being happy, enjoying the life.
Thank you. Okay, can I have a round of applause for the amazing panel? Thank you all so much for your contributions. It was really interesting, and I think we got a lot in. Thank you.
It's no break right now, right? There is no break. Sorry. Can you please stay in the room? There is no break. We continue directly with a short wrap-up session. finish at 1. There is no break. Yeah. No, but because people are standing up. Where is Tony? There you go.
Quickly. Sorry. I just want to make sure.
Go quickly.
Yeah.
No, let's
The plan is up on the stage. Let's go.
I want to avoid people are going away.
You're going to offer a reflection.
Hi, Carly. I'm Katrine. I'm thinking of the directly at this session. Thank you so much. Where is Anna? Ghana. Alexei. And I'm
actually going to do Dave Bewley first because I don't want to end on it. Do you know what I mean?
okay.
Is that all right?
Yeah, you end with?
Shall I do the David Bewley slide first?
Yeah.
Because I don't really want to end on a negative.
Yeah.
Yeah, just to remember him.
Okay.
And then we'll get into our session. Is that right? David Bewley.
Marta? Alexei, can you come? No, there is no break. No, and I want to avoid the people. Okay.
No. Okay. So, thank you. We are going to do the wrap-up session now. Thanks, everybody. But before I do, if I could just ask everyone to take the seats again. This is a closing session. I'm Tony Duffin. I'm the chair of Correlation Harm Reduction Network, the advisory committee. If I ask everyone to just take the seats now, please. We're just going to finish up. Thank you. Quiet at the back, please. Quiet at the back. Okay. Oh, so people are getting testy now, right? Okay. So first, before I do get into this next session, I do want to do one thing before I do, and that is to remember Professor Dave Bewley Taylor, who was the founder and director of the Global Drug Policy Observatory at Swansea University. He was also a co-founder of the International Drug Policy Consortium and was the founder and former director of the International Society for the Study of Drug Policy. Sadly, Dave passed away recently. There is a memorial for Dave. If you want to use the QR code, you can join online. And, you know, it is obviously sad, but we do celebrate his life. I know that he has friends and colleagues here, and he meant a lot to people. Equally, we have lost other people during the course of the year, and I want to remember them too. And if anybody here has lost anybody during the course of the year, we celebrate their lives and we remember them too. So I will ask people. I haven't finished yet. Okay, sorry. So I will just ask us to be silent for just for 30 seconds, just to remember them, okay? So we'll stop for a second. Thanks, everybody. Thanks for remembering them. It's really, really important to everybody here, I know. Back to our session. Okay. So this is not. It is the closing session
of the European Harm Reduction Conference. Of course it is, but it's not the end. At the beginning, I asked you all to think about what you want to get out of it, and I hope that you've got what you intended to get out of it. And I do hope that there's going to be relationships and networking and such that lead to other interesting things that come out of this conference. And maybe you'll tell us about those things in the future via email or something like that. So as we conclude, we're going to reflect on the powerful exchanges, innovative ideas and collective commitment shared throughout this conference. There's been robust policy dialogues, cutting-edge harm reduction practices discussed, and diverse voices and expertise represented here. And they underscore the importance of collaboration in addressing complex drug-related challenges. And we have a panel here today of wonderful experts, and they're just going to give us a few minutes each to reflect on the conference. So we have Alexei Lakov of EuroInput, we have Marta Pinto of University of Porto, we have Raffaella Rigano, and my pronunciations are terrible, I know, but I'm doing my best, right? And I say this just before I say Anya's name, right? Anya Dovbak. Correct? Good, thank you. Of Eurasian Harm Reduction Association. So my first person I'm going to ask is Alexei to, you have to stand up, you can take the mic and offer a reflection, it'd be great.
I would like to...
Don't worry about that.
Thank you, I would like to stay seated, actually. Yes, thank you very much for this amazing conference. I would like to start by thanking Correlation with organizing this event. And, for us, as the European network of people who use drugs, it was especially important that the communities were involved from the very beginning of organizing this conference, and that we even had the community program, that we also distributed, and the community-led session were specifically mentioned in this program, and you could actually see which sessions to attend. And I think that the running joke for this conference is about Stalin, how he would turn in his grave if he knew how his building was used now, And it's a good thing, because maybe it's too far-fetched conclusion, but I think that the ghost of Stalinism is actually coming now, all over Europe in different forms, in different meanings, but still this is Stalinism, this is fascism, and this is what we actually should counter against, because we have seen the rise in far-right movements, and this is actually impacting our communities as well, It impacts harm reduction programs, it impacts academia who are working with us, and it impacts other stakeholders who are actually who want to do something for people who use drugs. And this is why I think it's critically important for us, to discuss these things, to be really open about these things, and to find some common ground how to counteract these things. In terms of there were a lot of interesting sessions. I do not know, for example, for me personally, I've attended quite a few, and none of them was not engaging, or so I can't say anything bad about any of the sessions that I personally attended. I think that a lot of what was going on dealt with intersectionality issues, for example, because this is one of the important key points now in our field, because we have seen a lot of transgender folks, for example, non-binary people being stigmatized, being oppressed, and even within our own communities, to tell the truth. And this is not how it's going to happen. We are talking about human rights for all, for people who use drugs, for LGBTQI+ communities, for migrants, for other people, and we should follow this human rights path, if we want to really achieve some tangible results. If we want to do it for our donors, for indicators only, okay, then it's perfectly okay. We can just put it into our reports and go on with our lives. But if we want to achieve some tangible results, then we should follow this human rights path. And another important issue that I would like to focus on is funding. And we have seen, like, you know, during this year alone, we have seen a lot of cuts in international funding, for example. I am serving my term as an NGO Europe delegate to the Program Coordinating Board of UNAIDS, for example. And now we have seen how every year the funding for HIV response is actually decreasing, and it will continue decreasing, you know, so because we have seen how Netherlands, for example, cut down on their funding. You never know what will come down, what will come out of the next US administration. So yeah, I think that 2025 will be really hard, will be really difficult, and this is why it's critically important for us to stay united, because otherwise we will lose. We have been actually, it seems like we have been on the losing end of this war for ages, and now that we have started to actually gain some traction, you know, to achieve some results, we can't afford some stupid politicians, you know, to let us down. So that's why I think this is my main call and my main takeaway from this conference, that we should stay united and that we should counteract these threats that are coming from everywhere. It seems like they are coming from everywhere. Thank you.
I have an order.
Me already? So, hi everyone. I'm really glad to be here, but the party yesterday was really a great party, wasn't it? So, I'm feeling brainless because of the party yesterday, so I will stick to my notes, okay? So I won't get lost in my time. I want to thank Correlation for all the collaboration with the external evaluation. I want to thank Filipa Gonçalves and also Catarina Simas, who are my colleagues as external evaluators of C-EHRN activities. And I also want to thank truly to all the people that were available to cooperate with us in collecting data for the evaluation, namely through the interviews. Thank you very much for your generosity. We applied several of methods to collect the data to evaluate the activities. I'm not gonna bother you with that, but some preliminary results. About the conference, people show that they are really satisfied with the program, with the logistics, with the diversity and relevance of all the topics that were approached, with the speakers and participants, and with the quality of the communications. But they always underlie a lot the warm environment, the friendly atmosphere, and also the opportunities for networking, which improved this year with the application. Everyone made a great compliment to the possibility of going deeper with the interaction of other people through the application. Also, participants keep complimenting the Correlation team for the professionalism on how you prepare all the events. One of the people said the conference is great, everyone is very curious about each other, and networking is really strong. The program was very much appreciated, but people generally regret, this is very frequent, that they have to choose between equally interesting parallel sessions, and also they have to interrupt the discussions due to time constraints. This should be improved, I don't know how. This is important. For many of the participants, this conference keeps being the moment to regain the energy, the necessary energy and knowledge to go back and keep on doing harm reduction or improving what they already do. The escalation of the conference impact in their home countries was highlighted by many of the participants. They feel that like they take what they have learned to their countries, to their colleagues, and to their organizations. One of the persons said, I had a lot of lovely and funny moments, even before the party. And every time I go back, I feel I'm not alone. I'm so motivated, and I'm so full of this correlation energy. other person said, for me, this conference is super important to feel connected. I can't find this connection anywhere else. One person considered that since we are facing very hostile political conditions, the conference should dedicate more to the discussion, to the deep discussion of this political environment and less to technical and instrumental topics. About the correlation itself. The general feedback was really, really good, as usual. We are doing the evaluation for 3 years now. And the evaluation tells us that members recognize the European harm reduction landscape would not be the same without the network's contributions. This is really important, and I would like to highlight that this correlation, this network, is made by each and every one of you, and we should stick together more than ever, I would say. Harm reduction represents the very core of the democratic and contemporary European values and principles, and I will say that the present moment is not one more difficult moment as so many that we have faced in the past. I really believe this. We are facing a new civilization process, a new order to come. And I really consider, and many of the participants also contributed with this idea, that harm reduction practitioners are the community representatives of those values, of the democratic values, of the human rights values. And let's be honest, harm reduction is not about drugs. It was never about drugs. It's about people. It's about fighting for the dignity, for the possibility of each one of us to become what we are born to be. This is what harm reduction is. I think that's why it's so effective. We don't work focused on drug use. We are focused on people, and that's the difference that we've made. So I'm going to end up. Thank you. I'm going to finish just with a phrase of a person. What? You want me to finish, isn't it? No? Okay. Okay, thank you, Tony. I just want to finish with the phrase of someone that we interviewed who is not European. And this person said, she comes from another continent and has seen harm reduction under attack back home because of the far-right parties. And she said that we also have been through this in my country, and I could feel the tension between you, the threat that you might lose what you've conquered so far. And I've been through that. And she said, but the spirit of harm reduction is more than distributing care. It is an ethic of care that lives inside each one of us. So even if the environment is not favorable, this will never disappear inside of us. So even if in some periods we are constrained by political, social, or economic forces, I've seen harm reduction prevail. So I would end, if we spoke about Stalin, I think we should speak about Tolstoy, for example. And he said that the strongest of all warriors are time and patience. And also Mahatma Gandhi said that first they ignore you, then they laugh at you, then they fight you, and then you win. So that's it. That's my message.
All right. Well, as part of the organization, I just want to thank that, and it's so heartwarming to hear all that Marta is saying, especially at this moment. You heard in the beginning that we are also, as Correlation, facing financial issues at the moment, and we have been working with the pressure and without knowing much about the future, how we can maintain our activities. And I think this conference, I see everyone is tired, but with a huge smile in their faces. So you gave us a lot of strength and warmth, and I think also hope that we will conquer this together. So thanks for that. And I think I just need to echo what was said before. I think what I saw, my reflections, I think in the conference is that there was in a lot of sessions, like in completely different topics, whether we were talking about politics, about mental health of harm reduction staff, about monitoring harm reduction, this structural challenges come back. So we are fighting popularism, we are fighting extremism, we are fighting funding difficulties, and this affects us in many different levels. And what I also, and then having these moments as we have now as a community to come together, to feel safe, to talk about those things really bring us a lot of energy to keep going. And I was talking also to some people about, people felt the need of, we need to innovate more. So there is a sort of tiredness in different levels of many challenges coming and things we keep fighting, but things change very slowly or very minimally. So few programs come in, or programs that were built throughout decades are wiped out very fast because of war, because of extreme right policies. And so there is this tiredness in many of us about, okay, what can we do? There is a frustration. And at the same time, there is the need to innovate a bit how we look into what we are doing. Not necessarily maybe do different things, but also look differently at what we are doing already. And I feel that for that, many times we need spaces like this. We need safe spaces where we can share our frustration, we can share our challenges, and then from there, we can come up with something creative and something new and new perspectives on what to do. So thank you everyone for providing this space and for holding this space for us to grow as a community.
Hi everybody, it was a long year of preparing the conference for all co-organizers, and that was not easy. But what I need to say, we all in Eastern Europe and Central Asia implementing harm reduction as we are trying to hear ourselves here in this not very comfortable and cozy rooms. Because that's the same. The systems are not cozy. They are not developed for serving the person. They are developed for dominating over the person and for criminalizing people. But that's what we are doing for years, for decades, and that's what we are struggling now with. Unfortunately, the difference between Eastern Europe and Central Asia, which surviving, coping, or repeating the authoritarian past, totalitarian practices, which already 100 years of totalitarian regime, it's influenced all the people, and we are trying to cope and to survive or to forget to deal with it. But now, in this conference, I feel that the difference between us and the broader Europe and old Europe becoming less, and that scares me a lot. With the threatening for funding for harm reduction, with all these foreign law initiatives in different countries, with all of this talks about traditional families, and all this, that's really threatened me. I would love to make the difference less of us from Eastern Europe changing better for the democratic values and human rights, but not Western Europe coming closer to totalitarian language. Unfortunately, we see the absolutely other way out. But the good signs were that we have plenty of new people here and plenty of innovations here. The amazing experience of mental health provision for people who use drugs, of drug checking, even if it's legally gray, but you are doing this, of harm reduction for chemsex users. And there was such a lot of the new experience, just absolutely amazing. And in the hard times, we are developing something new, and I need to congratulate all of us with this. And what I see also, that we are less hoping, more becoming angry, more becoming honest in our language, not playing these diplomatic games of hiding our target groups under the name of target group or vulnerable groups. Vulnerable to what? Vulnerable to everything. So we need to say we are people who use drugs, we are sex workers, we are LGBT, and we are citizens. And that's what we are saying here. And the strong language and strong messages and narrative on decriminalizing and regulation. So we are moving forward. We are not saying humane drug policy, we are saying decriminalize drug use and possession, regulate drug market, make the changes now, because that's what society needs, and it's not only need of people who use drugs, it's need of society. That's very strong language which we see here, and I hope that this involvement of judges, police officers and high officials, mayors, prosecutors, they were here, that this learning from each other will bring us to the next point of our anger to become the policies and changes in the law. And I would agree with those who are saying, for us, once or 2 years, this is very important to have this family reunion with the drug policy reform guys, with the harm reductionists, with social workers, with community, because most of times we are alone in our advocacy and in our advocating, and we are facing like this ignorance, you again. But that's we are supporting each other in this movement. Do not lose each other. Make the connections closer, and don't be afraid of approaching each other and saying thank you. And from my side, I need to say that for us as Eurasian Harm Reduction Association, that was amazing partnering experience with the Euro input, with Yoda, with the precursor, and they did amazing work to make Polish, it's not translation, it's just accommodating us in more comfortable way here in not very humane situation. With the IDPC, and thank you for this focus on human rights and drug policy in the program, with Unite, and thank you for being with us and helping us with the high political level, with AIDS Action Europe, with ETG, Youth Rise, Alliance for Public Health help us with translation, and even though it was not easy to do and access, that's important issue for Ukrainians to hear what we are saying in their language. So that's crucial for us to be inclusive in this way as well, and thank you for them. Whom I forgotten? And Rights Reports Foundation. People are watching us all this time. Thank you very, very, very much for this, and that's for us was the incredible journey, and I sincere hope that in 2 years we will find resources all together to meet again and to hug each other and to support one more time, and maybe there will be more space for hopes and victories. Thank you.
Well done. Thank you, Anya. Thank you, Rafaela, Marta, and Alexei. Thank you so much. Before I hand you over to Katrine, I'll just say something to wrap up for myself as the chair of the advisory committee. Thank you. I was going to say this is the friendly conference, but you said the family conference. So it's interchangeable now. But it is. I just want to get a round of applause for everybody here, please, because you've made the conference. So let's have a round of applause. Yeah. Whoop, whoop. Right. And while I have you all here, just one last reflection from me. There was mention of innovation in the panel. And I've worked in low-threshold harm reduction services for over 30 years. I spent the last 19 years at the Analyphi Drug Project in Ireland, based out of Dublin. For my part, right, there's a number of things that lead to innovation, okay? I know there's other elements to it, but the strongest element is to engage with people and never, ever exclude them from your services, from writing, when you write policies at a legislative level, when you write service operational policies. If you go back, if you work in an organisation that actively excludes people, you need to go back and change those policies, because without engagement there is no relationship, and without relationship there's no chance for change. And when I say change, I mean that people choose. That's what I mean by that. So look, that was just my little rant at the end. I'm going to hand you over to Katrine now, who's going to... No, what are you going to do? I just finished it. Anyway, here we go. Here we go.
So, I promise I will be very short. And, yeah, because everyone wants to go to lunch. There have been a lot of things being said. I will not go too much into detail. But I loved a few things. Lynn Ruan, for example, she said we should do zero tolerance. What was it? Zero tolerance on poverty, and zero tolerance on inequalities, zero tolerance on criminalization, and zero tolerance on stigma. And when I opened this conference 2 days ago, I was also talking about being angry and tired. And I think I cooled down a bit during this conference when I spoke to all of you lovely people, because, yeah, it's very inspiring being with you and it gives hope. But still, I think as a last takeaway for me is that we should still create more evidence where possible, but also be sure that we have a lot of evidence also. And now it depends on political will. And I think we should try to get this political will, probably less diplomatic indeed, and we just kick it in another way. And if we cannot reach policy and decision makers by providing evidence, then we turn to the people, the society, and probably we can turn them around more easily. And this is to what policymakers in the very end always will listen to. And I think our whole community here is strong, inspiring, great. It felt for me like a warm bath, and I have been emotional here and there, and I have been lots of laughing, lots of discussing. It's really amazing. So I go back inspired, bursting with energy. I go back with lots of new ideas, also quite relieved that the conference is over and that everything went well, and slightly sad that the conference is over and everyone goes away. So you fall a little bit in a hole and feel very lonely. And I also go home, and I think this comes from many as you as well, really exhausted, especially after this wonderful party we had over there. And I want to thank the two super DJs, Mireia and Jochen, who really gave us a great time. And Mireia told she will always be able to do that again, as long as we promise her that her session is not on the next morning at 9 o'clock. So yeah, a few things, what happens at the end of the conference, that you start thanking people. Oh, can I have the next slide? This evaluation slide. I hope it's there, because this is an important one. Yeah, there is a QR code. Everyone asked me during the conference, how can we help? This is how you can help. Please fill in this evaluation for the conference. You can do it right now while I'm talking. It's important. It's not only important that we can improve our conference in the next years, but it is also to show to our potential funders how amazing we are. So, but be critical, fill in whatever you like, but please do it. It would be really great if we get as many as possible responses. And now I'm going to thank a number of people. First of all, I'm going to thank you, all the participants, for being here, coming to lovely Warsaw, spending so many hours in this building, talking, discussing, laughing with us, sharing with us. And I would also like to thank all the speakers, moderators, panelists, for their contributions and engagement. Also the program committee, happily, Anna already read all the organizational names. We had a list of around 10 organizations, and I know if I would now start reading them, I definitely forget one, so I don't do that. But they really contributed and helped to make this program be balanced and work. I would like to thank our sponsors and supporters, starting with the City of Warsaw once again, because they provided us with this venue. And some of you have said, yeah, probably next time look for a venue with a better acoustic. We get it as a present, and I think that it was still a great and wonderful venue, and the rooms were amazing, and sometimes we had to shout a bit more, but this is what we can handle. I want to thank the City of Amsterdam for their support, also the European Commission, Gilead, and also the EUDA. Special thanks, I did this already at the opening. I want to thank our host organization, Stichting de Regenbooggroep. They have been supporting us ongoing with financial support, technical advice, practical knowledge. And I think the existence of 20 years of correlation is, first of all, we can thank the organization, our organization. And I would like to thank you for being there for us and not letting us down also in this very difficult situation currently. Also, I think a warm applause for our volunteers. There were the people with this sweet pink. And the correlation team. And then we have the whole correlation team. It was great. They all worked really, really, really hard, and there was no one who could escape in one way or the other for doing stuff. So it was super great to have you. And special thanks now for those who really worked most for the conference and really worked their asses off, or socks off. They worked many days, but also sometimes in the night. They also solved lots of problems. They didn't lose their mind, and they didn't lose their patience. So, first of all, two very super duper correlation people who made all the logistics and all the support. This is Lea and Steph. I want both of them to come forward already, come to the front. And I also want to thank our local partners. This is Kasia, who is unfortunately no longer here today, and Magda from Precursor. Can all three please come here to me? Come. And where is Magda? Where is Magda? Not listening to me. So It's, again, without them, it wouldn't have been possible. And Kasia and Magda were the ones which really organized everything here in Poland. And yeah, great. And Lea told me yesterday she's now in the mood to actually continue. She would like to organize a next conference with the knowledge of today. So if anyone has anything to organize, reach out to her, please. So, and now I also want to thank Peter Sarosi and István Takács. So, there is Magda, please. Thank you so much. Thank you so much. And so now we have a really nice closing thing. I will stop talking and István will show the video which was made during the conference. And please be aware, after this session there will be a lunch, and then the satellite event of the City of Amsterdam will be organized here, and you are all invited to join. I wish you safe travels home afterwards, and thank you all again for your being here.
Hi, we're in Warsaw, Poland, and this is a place where we have our drop-in center, and you're welcome. When we talk about harm reduction service, it shouldn't be just the equipment exchange, and that's the thing. I mean, when you have needles and syringes somewhere on a shelf in your office or service, it's not enough. It's not a harm reduction program for me. So here it is. Here we are distributing needle and syringes so that people can use new ones. Here we have a room where people can rest, hang out, and spend their time. There are actually 2 centers, harm reduction centers, who I would call harm reduction services, where people get this offer that is much more comprehensive, and it's just not limited to HIV and hepatitis C prevention. We have a kitchen here when people can eat warm meal, which we provide, and drink coffee or tea. They can have a shower and wash themselves. This is super important to feel good. And our nurses' room, where we do testing, HIV, hepatitis C, and where also our nurses on the duty helping people with various issues. You need to have social support, material aid, legal support, and many other services and offers to really say that this is the place that people can come in and get what they need.
Harm reduction in Europe and globally is under pressure. And despite overwhelming evidence that harm reduction works, services remain underfunded. And in many countries, basic harm reduction services are not even available. I'm concerned, but most of all, I'm getting really angry. And I know many of you are getting angry as well, because we are tired to being asked what we already know. Harm reduction is grounded on human rights, it's grounded on evidence. Harm reduction works, harm reduction saves lives, and it is cost effective. And in principle, harm reduction is the best thing you can get.
I think that harm reduction is much more than preventing bloodborne viruses and preventing overdose deaths, okay? I think that in many ways we've sold ourselves short. We achieve a lot more than that. We link people into services, we get people into treatment and rehabilitation, we link people back to families, we get people into housing, we deal with trauma. So, you know, there's much more. And what harm reduction as a movement and as service providers need to do is tell that story, explain that to the wider public, to the funders. So, yeah, we just don't explain ourselves as well as we should.
The harm reduction project from Ukraine, we work with corner at the parties, at clubs, with protection things like sniffing kit, like condoms and lubricants. We have like party box. Party box included oral HIV test, some supplies for production, and the main part of this is reagents for testing supplies. And we really try to be more like a friend for young people.
I'm from self-support group, so our street workers. We do outreach towards people in great precariousness, concerned by drug using, as us, but also homelessness and all kind of infections and chronic diseases we are learning here together. And so thank you, really thank you for this conference.
I'm actually from the U.S., near Chicago, and I coordinate a program distributing Narcan around the area. Mainly came here to learn about European drug policy and really get inspired and bring things back home. And it's been great to meet people from all around the world, and I feel really lucky to be here.
How would you characterize the situation with harm reduction in Iceland?
Well, harm reduction in Iceland actually started really late. Our first harm reduction program was put on in 2009. But since then, we have managed actually to bring up quite a lot of harm reduction services. And on the national level, there is a lot of support for harm reduction. We now have a needle exchange very accessible. We have also opioid treatment. In the center of Reykjavik, the capital, we have a DCR, which is both for smoking or inhaling and also for injecting, and also a nurse clinic. Research show that around 50 to 60% of people living in Iceland, they support decriminalisation. That's one of the biggest advocacy we see in Iceland, that we really want to push for decriminalisation.
We have a wave of new synthetic opioids coming in onto the market. We don't know them yet. We're still getting used to them and trying to find out, okay, how can we make that safe? In Norway, the overdose situation, it has not gone down. It is growing. We have already this year had 20 to 21 overdoses on nitocines, and this is the time where we need to consider all the options we have. Drug consumption spaces, safe places where people can use drugs, safer supply, definitely.
What does the emergence of new synthetic substances mean to harm reduction? Do the traditional programs such as opiate agonist treatment, naloxone, do they work for synthetic opioids too?
Everything works. Everything works, but it has to be revitalized and it has to be revised. So treatment programs have to look at the programs that they're providing. They have to look at the quality of their programs. They have to look at the inclusion criteria. Is everyone included? And of course, overdose reversal medication, naloxone, is extremely important.
Opiate agonist treatment is now a mainstream form of treatment. But what about stimulants? Can we substitute the street stimulants with something?
Well, there's interesting pilots going on across Europe also, in Australia I know, with, for example, Ritalin or dexamphetamines. We now have a pilot in the Netherlands with slow-release dexamphetamines, so it's still quite in a pilot phase, yeah.
What about cocaine? I've heard that in the Netherlands you are starting a very early pilot stage program.
Yeah, we want to explore in the City of Amsterdam, which is at the moment very progressive in its drug policy. So we want to explore whether it would be possible, same as with heroin, to have sort of cocaine-assisted treatment, let's call it that, where you basically offer people a legal supply of medical quality or pharmaceutical quality cocaine.
Victor, the Czech Republic is planning a quite innovative way how to regulate psychoactive substances. Can you tell us how you are going to do this?
Yes, in fact it passed already a whole legislation process, and it will be effective since the beginning of the next year, a new category of psychoactive products to be on the market for people to be used. Substance with low health and social risks, and it should be new psychoactive substance, so not controlled by international conventions or by EU law, this Council framework decision, as a drug, as an illicit drug. There will be health warning, safety warning, information for consumers, including risks, effects of the substance.
In Malta and maybe other European countries, stigma and discrimination continue to negatively impact the possibility to address certain injustices. For example, one of the biggest issues and one of the biggest pains for me is the availability of an addicts registry, which continues to negatively impact on the quality of life of people who needed treatment and have been put and placed in this registry practically for life. And this is a draconian and an inhumane way how to deal with problematic substance use.
What is your message to those harm reduction services where there is no specific service for women, no specific spaces for women?
So I think we have to address not only women, but also queer and trans people needs. And we need to create, considering the spaces we have. We adapted some existing drop-ins to drug consumption rooms. Now we need to adapt drug consumption rooms that exist also to specific needs of women and queer people.
We are slowly, but unfortunately, I'm afraid, surely going towards a less democratic Europe. We have half the member states that have either a far-right party or a populistic party in the government. If we don't pay attention and if we don't try to redefine and reinvent our role, I think there is a risk for all of us to lose all the benefit of the past 30 years of European drug policy.
The shrinking space for civil society organizations that happens across regions of Central Europe and Central and Eastern Europe and Central Asia, and now it's more evident that is the thing of the Foreign Agents Act is getting more positions in different countries. They will be able to decide if we are friendly and affecting democratization process in our countries, claiming that we are endangering the democratic processes in our countries. Actually, it's completely opposite. So we could be fined, we could be arrested, we could be limited in various different activities, and it will affect our daily lives.
Even in a harsh time when there is criminalized activism itself, criminalized advocacy, like in Kyrgyzstan and Georgia, that's important for us to bring pragmatic public health based on the key value of human life and dignity services and policies. And I have a hope that in the darkest night we could have some countries and some brave politics, and we do have them in the room as well, who could bring these policies.
In Italy, the situation is very hard because we don't have an harm reduction national policy. As the new government is a fair rights government, we are in a resistance phase in our country.
Do you know any good practice how to fight populism?
How to fight populism? Well, it's a very hard question. Maybe we should build an alliance with other movements for the rights of people, like the LGBTQA community and civil society who works for the rights of people from other countries is very important.
We have some very conservative who are against the DCR, always trying to find some
argument to close it down. They did that last June. They sent some administrative inspectors in the DCR, in the 2 DCR, and all around the harm reduction services to get argument to close. And at the end, they produced a report, really positive, that said that the government shouldn't close the DCR and should open other. So it just came back into their face.
There is an ongoing discussion whether we need to reinvent harm reduction. Do you have anything to share about this?
For me, reinventing, it's a big word. I think harm reduction is one of the 4 pillars of the drug policies in Europe. What I would like to see is a standardization of the 4-pillar policy within Europe. There is a polarization between West, we see a lot more direct consumption room opening, and the East being left behind. When the European Union has to answer a crisis, such as COVID crisis, they impose certain standardization. When it's about food industries, there is some standardization. When it's about healthcare and access to healthcare, there is not. So this is something that I would like to see.
The European drug strategy, that's a very nice document on paper, and we worked in preparations of it and evaluating it. And from time to time, the evaluation said that we could not reduce the supply and demand of drugs, so that in governments were pretty unsuccessful in that. But harm reduction is pretty successful, and still what we have is much less resources on harm reduction, and in many countries don't implement the EU drug strategy.
We need to push EU member states to implement the EU drug strategy, to which they all signed up, and implement it in a balanced way. And we need to demand that the European Commission, particularly DG Sante, responsible for health, establish finally and for the first time a dedicated funding mechanism for harm reduction and a health-based drug policy approach.
The overall success would be, to have a 0 HIV cases, full OAT coverage with great treatment and so on. But this small scale is also, I think, something we have to hold on to. When things are so challenging and when you feel that your capacities are so limited. It can start there, and very often it ends there, right? A small scale of just letting someone else feel that their life is worth, and that they count. But it's a lot. It's a lot.